A few weeks ago, we told you about a Valley organization providing free health care for working mothers and their children. It is called WellCare, and it serves mothers who are not receiving state aid but can't afford private insurance. After our story, more than 50 mothers called looking for some help, but as Patty Kirkpatrick tells us tonight, before WellCare can help them, they need you to take some action.
I went and changed it to May 2nd at 9:30 in the morning.
From making appointments to taking blood pressure,
I'll get you one.
stocking cotton balls to tracking medical charts. With 5 clinics and more than 300 patients under their care, WellCare is like any full-scale medical office.
It's a full-blown office, and the phones and the overheads and the expenses and copies.
The difference, says Jane Cisneros at WellCare, is that at the end of the day, there is no reimbursement from insurance companies, no government check, no Medicaid repayment. They rely on grants and donations, 2 sources of income that have shrunk dramatically in the last few years.
This is probably one of the toughest times in history for nonprofits, even those that have been around for quite some time.
Although her firm does not work with WellCare, Bettina Nava at First Strategic works with a number of nonprofits in Arizona and says, first of all, we have an economy where more people need help from nonprofits and fewer people have extra money to give. And it's especially tough in Arizona, where we don't have a large corporate base.
Since we don't have those corporations really present in a very highly saturated way, we really are depending on individuals and small businesses to step forward and really try to help out.
Jan Lee Sprode at WellCare says many people also don't realize what happens when nonprofits go away.
If the not-for-profits aren't able to provide that service, guess what's going to happen? They're going to go to the emergency room where they're unable to pay. And then the hospitals are going to have to make up those dollars.
The bright spot, despite the challenge, the high costs, the great need, is that every one of us can help in a small way.
Well, right now we need a donor that's going to give $10, $5, $25, $100.
But it doesn't have to be the $50,000 or $5,000 that really helping our community thrive and create a good quality of life comes at $15 a person, and it really does go a long ways.
Now, we are told 40% of nonprofits in Maricopa County could close this year. WellCare says without donations, it could be one of them by early summer.